The world has come to know something called HPV, the human papillomavirus. There are many websites, clinics, and other sources that allow people to research this very well-known sexually transmitted disease. The data indicates that 50% of sexually active men and women acquire a genital HPV infection in some point in their lives. True fact by the CDC. Like I stated, 50% of people get genital HPV. Genital HPV, also known as HPV, is the most common sexually transmitted disease among men and women. There are 40 different types of HPV that affect the genital areas of males and females. They also infect the mouth and the throat. Most people become infected with HPV sexually. A lot of people don't know they have it. Some signs and symptoms of the virus are genital warts that cannot be seen on the outside. That would be genital herpes. Genital warts are seen on the inside of the cervix of women and on the penis of males. A lot of males don't show symptoms though. Other HPV can cause cancer in women. Some signs and symptoms: genital warts usually appear as a lump or bump of groups of bumps in the genital area. They're small or large, they're raised or flat, or they're shaped similar to a cauliflower. Cervical cancer usually doesn't have symptoms until it's quite advanced. Other HPV-related cancers might not have signs or symptoms until they are advanced and hard to treat. The cancer includes the vulva, the vagina, penis, anus, and the head or the neck. How do people get HPV? HPV is passed through genital contact, most often during vaginal sex. It can also be passed through during oral sex and genital-to-genital contact. It can be passed between straight and same-sex partners. HPV has been passed for many years, and has been passed for many years, and people still don't know they are infected. A pregnant woman with HPV can pass it to her baby during delivery. The baby can have RRP. So they'll have symptoms of HPV right away. This can cause blindness. It can cause other birth defects. It causes cancer by the cells. Women shed their cells quite often as young women, and as they get older, they keep the same cells. So women that usually are at a younger age, they don't get this disease, they get this disease, but they don't keep it. The cells change and the disease changes. HPV, there are common related diseases. It says approximately 20 million Americans are currently affected with the HPV virus. Another 6 million people become newly infected every day. It's so common that, like I stated before, 50% of men and women have this STD and don't even know they have it. And then they just show some statistics here that each year there are about 3,700 women who get vulval cancer, 1,000 women who get vaginal cancer, 1,000 men who get penis cancer, 2,700 women, and 1,700 men who get anal cancer from this HPV virus. And certain populations are at more at risk. So here's a graph that shows the HPV-associated cervical cancer rates. This is between 1998 and 2003. Black Americans had the highest at 12.6. This is out of 100,000 females. This is a female chart. Then Hispanics had the most at 14.2. And then Black Americans had 12.6. And non-Hispanics and whites had 8.4. And the Asian Pacific race had 8.3. And it says here about 14 Hispanic women were diagnosed with cervical cancer per 100,000 women. And this is also a graph that was adopted by Watson, Bernard, and Coughlin. How we can prevent HPV. There are several ways we can prevent HPV. The first one is abstinence. The second one is to use protection as condoms. The other one is to have the same partner, not multiple partners. Some of the ways that we can test for HPV are pap smears for ladies. They can be tested just through a simple pap smear. If they test positive for the HPV virus, then they'll be tested for which type, high grade or low grade HPV. Then after they're tested and their test comes back negative, that's a good thing. If it comes back positive, then the doctor has to do something called a colposcopy. This procedure calls for the doctor to put an acid solution or a vinegar solution on the cervix. And the genital warts, if they're there or if he can see them, they will turn up a grayish color. The grayish color means precancerous cells. Once he does that and he sees something that looks suspicious, he will take a biopsy of the precancer. The precancer is also then sent to the lab to check to see what grade or type it is. If that test comes back that they need some kind of procedure, the first procedure would definitely be a cryotherapy. This is where the doctor goes in and he freezes the cervix. And as he freezes it, the frozen cervix will then shed. Once that cervix sheds, then all new cells will form. And normally, women who get the next pap smear will have a clean and clear pap smear and won't test positive for the HPV virus. They hadn't found a way to test men for the HPV virus yet as of now. The other thing I wanted to say was they have the Gardasil vaccination. It's a 3-shot series. Women get it, teenagers get it at the age of 13 all the way up until 26. Normally, if you've already been sexually active, they don't recommend that you get the vaccine because it's possible that you'll have the HPV virus. Because remember, as stated before, 50% of Americans, men and women, have this virus. You can get more information from the CDC. You can get STD information. You can also get the HPV National and Cervical Cancer Prevention Resource Center, and that is actually in North Carolina. And just once again, statistics state that approximately 5.5 million new cases of sexually transmitted diseases, transmitted HPV infections are reported every year. Those 6.2 million new infections are estimated to occur. At least 20 million people in the United States are already infected. So that is the 50% of men and women that are infected with HPV. So just in conclusion, I'd like to state that protection is number 1, abstinence, and knowing your sexual partner.